Hi, welcome. Let's talk about how to bolus IV fluids. Now, most of the time, the indications would be pretty narrow. One of it would be shock, a patient, whether it's hypovolemic shock, whether it's septic shock, cardiogenic shock, and so on. The initial response is to try to bolus them with IV fluids. Now, you want to make sure that you use either lactated ringers or normal saline. Do not use any hypotonic solutions such as D5 or D5 half normal, which may lose its efficacy pretty quickly. So you stick with LR or normal saline if possible. Now the next thing to do is try to have a setup. You just need either peripheral IV access, and usually 16 or 18 gauges would work just as well as a central line. So you don't need to set up for a central line, which can take up to 45 minutes to an hour before you set it up and get it confirmed. Obviously the next option is, apart from a peripheral IV, central lines. But an intraosseous device as well may be helpful. Most EMTs, ER docs as well should be pretty well versed with this. So if you need to phone a friend, especially if you're on the floors or in the ICU, you could page the ER doctor to come and help put an IO in if needed, especially if the patient's a difficult stick, for example. So now, how do we bolus, or how do we give a fluid bolus? Well, the first option is to squeeze. So you just squeeze it in. At the top of the bag, the normal saline bag, squeeze it downwards, squeeze this, and then make your way downwards. This will get the fluid in within 10 to 20 minutes, and that's a pretty effective old school way of doing it. The next way is to pressure bag it. Now, a pressure bag looks like a blood pressure cuff, or you can even use a blood pressure cuff. And how that works, if you want to apply the blood pressure cuff here and you keep pumping it up till it squeezes this downwards, similar to what you were doing earlier with the squeeze technique. The pressure bag technique as well, the actual pressure bag encompasses the whole normal saline bag, and again you have this pressure over here that you inflate the bag so that it squeezes it and gets the fluids, and usually within 20 minutes as well. The next option is wide open, so you use gravity, and what you do is, if the patient's laying down, just make sure you have the bag up above the level of the heart. The higher the better. Run it wide open. If you have two bags and you have two IV accesses, you can run them in wide open, and this is without the IV pump, so no IV pumps need to be used. Just run it open to gravity. Another option is a rapid transducer, and the trauma surgeons would be more familiar with this. This is used a lot in the EC and by the trauma unit, and what this does is it allows multiple bags of fluids or blood products and so on to go in at the same time, and this runs it in within 10 to 15 minutes, and again you need adequate IV access for this. The least effective method, and I see the one that's practiced the most, is the 999 on the infusion pump. Now this works well if you're trying to increase the amount of fluid that the patient has, as opposed to bolusing them. So to adequately reverse or try to halt the drop in the blood pressure or shock in someone, the 999 infusion is not going to work as effectively. So you may want to change that technique to some of the other techniques we discussed, which is either squeeze, pressure bag it, wide open, and the rapid transducer. All right. Happy bolusing. Thank you.